Hello, everybody, and welcome to the Mental Health Minute. I am Phil Cerrone, the Chief Operating Officer of Elite DNA Therapy Services. And with me always is my colleague and Chief Clinical Officer, Dr. Sharon Bloom. How are you, Dr. Bloom?
Hi, good morning, Phil.
How's everything?
Oh, good, good. Can you believe we're halfway through May and it's Mental Health Awareness Month?
It's crazy. And, being with Elite DNA for now 6.5 years, I feel like every year Mental Health Awareness Month gains a little bit more steam. And I think people are talking about it a little bit more. I don't know if you feel the same way or what you're seeing.
Yeah, I think we're doing a good job at spreading that awareness.
So, and kind of tying into that in the Mental Health Awareness Month, the great thing about therapy in general is that every therapist is unique. And whether it's based on their experience, their expertise, um, their own life experiences, they each bring a different approach. And so what's great about Elite DNA is we have over 60 therapists. And so each one of those therapists has a different way that they do things or that they approach the sessions with their clients. And so one of our therapists, Emilie, who's in our Naples office and also doing virtual visits right now, is joining us. And she has done a really great job providing some written content for our social media. And she's done 3 pieces, with the third one coming out this week. And each one is very interesting. And so I would like to welcome you to the show, Emilie. And I'd like to see if you can kind of touch on each one of those 3 and how it relates to maybe the lives of our clients or anyone watching.
Okay, thank you. Glad to be here, Phil, and thank you, Dr. Bloom. So the first of the articles that I've written for our website is about binge watching. And that's something that, we've seen a huge increase. Some studies are saying that Americans are now binge watching up to 8 hours a day. That is a lot of time in front of the screen. Mm-hmm. So what that first article is looking at our watching practices and things we can do to engage ourselves in other activities, keep ourselves going, find other hobbies and things that we can do as a family or individually, other than plopping ourselves in front of the screen. And the reason that's so important is because we're finding that we're using that as an escape, something that is distracting us from what's really going on, which can be wonderful in moderation. But we want to make sure that we're not overdoing it. And that's really the focus of the article, is making sure that we're doing it at a healthy amount. And that avoidance and escapism is something that we talk about in the mindfulness. And mindfulness is really bringing your focus and your attention to the present moment, being aware of what's going on within you and around you, so that we're not just on autopilot, we're not deep in our heads ruminating, thinking about something endlessly. Really bringing our attention to what's going on right here, right now. And that leads into the third article. When what's going on right here, right now, is something that's painful, stressful, or a crisis, that's a time when we would use our distress tolerance skills. And those are things that when we recognize we can't really fix what's going on, like coronavirus, that's a time when we'd be able to say, okay, I can't fix this, but I can change how I'm looking at this, and I can change how I'm responding to it. And this is a set of responses that people can use to help themselves feel a little bit calmer, a little more emotionally stable, and feel that there's something in my life that I can control, and it's something that's healthy for me. So that's kind of the focus of each one of those 3 articles.
And Emilie, given the current climate, what are you incorporating with your patients now, or what can we incorporate at home? 1 or 2 things more specifically.
Yeah. So I think that some of the things that are really important to incorporate right now is a good balance between, needing to be present and needing to have some time for enjoyment, for getting out of our own heads. And so that balance of distraction with escapism, with being present and mindful, is something that I'm really working on incorporating with everyone I see. Because while DBT was developed originally for use in borderline personality disorder, it has applications across every diagnosis. And even for people who may not have been formally diagnosed, it's a way to manage our stress, to manage our interpersonal relations, and to help us get through times of crisis, times of really high stress. So being able to balance that and bringing some of those coping skills, what DBT calls distress tolerance skills and crisis survival skills, are something that I think will apply to everyone.
So, Emilie, you speak about mindfulness, and I think a lot of the people maybe watching or listening to this, aren't exactly sure what that means. So I think that term is used loosely. Like, for example, my master's is in exercise science and health promotion. And so, I've spent a lot of time training people, training athletes. And one thing we would talk about is being mindful of, the mind-muscle connection, knowing where your feet are, knowing where your hands are going. But how does that relate to, something you would do in a session, or maybe something that people can be doing either themselves or for their children at home?
Yeah, that's a great question. So one of the ways that I like to incorporate mindfulness is in a series of things called grounding exercises. And so these are things that we might do when we're feeling really high stress, some heightened emotions, things that are kind of going all over the place. And we need to really center ourselves and bring ourselves back to this present moment. So what we might do is plant your feet firmly on the floor, straighten up your spine, and take some deep belly breaths. And while you're doing that, you're going to be aware of the air coming in and going out. You're going to be aware of the feeling of your sit bones on the chair, of the weight of your feet on the floor. And you might notice your mind wandering, going different directions, but you keep bringing it back to this present moment and the physical sensations you're feeling. And by doing that, we're able to bring ourselves out of a time of high crisis, high stress, or sometimes we find that our minds get going and we forget where we are or what's going on. And so it really is a calming and centering exercise.
I like that. And I like the point that you made, Emilie, that mindfulness is not the same as simply spacing out. That, in fact, would be mindlessness, I guess. Mindfulness is paying attention on purpose. And I think it can really be a building block towards being able to recognize and respond to our emotions by being able to observe them without being totally trapped and overwhelmed by them. I like to do simple mindfulness games as well. I think they're very easy to do. You can do them, without anyone knowing you're doing them. Only takes a minute or two. So one of the games, well, it's not really a game, but I call it the rainbow game. So you're sitting in a waiting area. Well, maybe now you wouldn't be, but you're sitting in a space where you feel kind of anxious. And all you're going to do is scan your environment, visually scan your environment, and try to find the colors of the rainbow in order. The only rule is you can't go back to the same source twice. So in my office, I have very colorful paintings. If I find red in one of them, okay, off limits. Looking around, combing my environment visually, trying to find those colors. And while I'm doing that, I can't simultaneously be worrying about the thing that was on my mind before. I'm pulling myself into this present moment, and it's a calming, soothing activity that makes me very present, because anxiety is, mostly future-oriented, what's going to happen that may or may not happen, or something in the past. I can't change it anyway, but I'm dwelling on it. So being in the present moment is a protective factor against, that stress and worry. Similarly, you could just go for a walk and say, I'm going to go to the mailbox and back, and all I'm going to do is pay attention to what I hear. And trust me, you're going to hear things that you've never heard before. Why? Because we're always in our head and we're not paying attention. So we're practicing paying attention on purpose. And like Emilie said, being present in that moment. And it's such a great skill. It's fun for kids, and it's something that you could teach everyone. Everyone could be doing it. So it's definitely a popular one. I think it's great.
It's like playing a therapy version of I Spy.
Exactly.
Yeah.
And Emilie, just to touch on that first article, which was the binge watching article, I think a lot of people, including myself, who normally does not watch TV, maybe I'll watch an hour or two on Saturday and Sunday, but now I find myself, just because, there's not much to do. You can't go out, now, we live in Florida, right? So it's getting to the point where it's hot. So even going for a walk in the afternoon becomes a little bit difficult, even though we've had some good weather over the last week and a half or so. So is there something, and I encourage everyone to go read that article. It's very well done and talks about little steps that you can take and, things you can do to set yourself up for success. But I'll ask actually both of you, I'll start with Dr. Bloom and then go to Emilie. What are one or two things that you do to press pause on the TV aspect whether it's just for you or you and your spouse or you and your family, that you can do, that you personally do to get away from, the Netflix or the streaming or binge watching TV?
Well, in our family, every day at 6 p.m., it is the Bloom family walk. And this means we leave our phones in the house and we walk like a pack around the neighborhood for 20 to 30 minutes every day, like clockwork. No matter what we're doing, we drop everything, we convene in the front hallway, and out we go. And this sometimes is the only time that I'm outside. And so that fresh air, that vitamin D, that time together, the time away from electronics is so important. It's like crucial. So that is something that we have been doing since day one. And although there was a little complaining in the beginning, now I think everybody looks forward to it. And if someone's late, it's like, where are you? So it's become definitely part of our routine. How about you, Emilie?
Well, for me, what I've done is I've implemented a limit. Like I talk about in the article, setting an agreement with yourself of how much time or how many shows you are going to watch that night and sticking to it. So my agreement is that I will watch Wheel of Fortune and I will watch Jeopardy. And beyond that, the TV is off. So instead of going to the TV, it's playing a board game, playing cards with the family, going out and gardening. My tomatoes and green beans are coming in nicely. I've recently taken up chalk art. So all those delivery drivers you have coming to your house with food or with packages, it could be fun. Even with the kids, get everybody involved. Make some designs out on your sidewalk, something to welcome your delivery drivers, and to get away from the TV and do something creative, something physically engaging, and something where you're creating social connection between your family.
That's awesome. Yeah, and I think, same thing as you, Dr. Bloom. We normally, now, usually anywhere between, 5:45 and 6:15, we'll go for a walk around the neighborhood. It is getting a little bit warmer, and, if it's one of those humid days, we'll actually play. My kids, for some reason, love the matching game, so we have a Marvel matching game, or we do Legos, which is, fun for the family because everyone has a little piece of something that they can create. And we actually have the big Harry Potter fans in the family, but we have the Hogwarts castle that we're assembling right now. So it's a 6,200 piece Lego set. So that we're on week 3 now. But those are the things that I think as a family we do. As myself, I've been spending a lot more time. Again, you have to get creative because gyms aren't open. In creating workouts for myself, and kind of getting back to the things I went to school for. And having to, reopen some of the textbooks to see, why would I do certain movements? Because I think, because we're limited in the stuff that we can do, like, again, when we talk about the gym, everything you have to do has to be purposeful. So I think creating programming for me and some family members around working out has been keeping me busy as well. So I think there's definitely things that people can do or passions that they can, reignite during this time just to keep themselves, busy and off the TV and off the phone. Well, perfect. So, again, I encourage everybody to go to our social media, read the 2 articles that Emilie has put out. The third one will come out, I believe, on Friday. She has been a great addition to the team. The stuff that she brings to the table as far as the content has been really original and just, I think very helpful to anybody, whether it's someone who's single, somebody who has a family, somebody who has anxiety, someone who doesn't. And I think, we could all just take a few minutes, 10, 15 minutes. They're, really quick reads. And just read those. So thank you, Emilie, for joining us and kind of going over some of that content. Enjoy your Mental Health Awareness Month. And thank you, Dr. Bloom, for, as always, for your time and for your input and helping our viewers kind of get a better understanding of what they can be doing at home.
Sure. Thank you.
Thank you, everybody. Have a great day.
Thank you. You too.